afternoon, everyone. My name is Antoinette Valle. I work for the Family Health Clinic. I am an insurance navigator and do some outreach for the clinic. Today we have Julie Langston, our Women's Health Nurse Practitioner. Hi, Julie. Thank you so much for joining us today. It is Women's Health Month, and we are also having a virtual baby shower through our Facebook page. And we wanted to just touch upon some topics with our Women's Health Nurse Practitioner. So hi, Julie. What is prenatal care and why is it important?
Well, I want to start with why prenatal care is important. It's important because we want to make sure that the mother has a successful pregnancy that is healthy for her, and that we have a successful term pregnancy where our baby is healthy.
That's very, very good. When should a mother start her prenatal care? At how many weeks or months?
Well, ideally, we like to see them in that first phase when they're finding out they're pregnant. So a good guide is if you're 2 weeks late for your menstrual period, you can call us and come in and meet with one of our clinical staff persons, and they will run a urine pregnancy test. And if it's positive, we'll kind of get some information on when you think your last period was, figure out how far along you are, take in any medications that you're using so that we can determine if we need to change anything or see you sooner. Just get a quick little snapshot of what your medical history is. After that, that's forwarded on to me. I kind of look at everything. I send in prenatal vitamins for you. If we have samples here in the office, we'll start the mother on them. And I usually like to see around 10 to 12 weeks. That's when we know the pregnancy is, probably going to go on, and it's a good time for us to do your physical assessment and a more in-depth screening of the mother and her family history. But when you talk about starting prenatal care, actually it begins before you're even pregnant. We call it kind of some preconception care. And in the United States, the majority of our pregnancies are still unintended. So we always need to behave in a manner that we think we might get pregnant. And that can include for women that they need to be taking in folic acid, at least 400 micrograms a day, to help prevent any spinal birth defects. We know that taking that amount of folic acid greatly decreases your risk of a baby having a spinal cord defect. So by the time the fetal spine is closing up, that's about the time women figure out that they are pregnant. So that's why we want you doing it beforehand. So, and if you think that you want to get pregnant and you know you want to, we want you to come in and see us so we can go over your risk factors, look at your full health system and see if there is anything that we need to address. A lot of times women don't enter care for themselves because they're busy taking care of families and doing other things. And their first entry into any sort of healthcare for themselves is when they're pregnant, because they have to come in. And so we miss testing people for diabetes and diagnosing that, mental health disorders, hypertension, any of those things. So you should come in, at least every couple of years, just for a women's wellness visit as part of preparing yourself in case you get pregnant.
Well, that's very good information, Julie. Thank you so much for sharing. And thank you everyone for watching this video, and stay tuned for some other topics. Thank you so much, Julie.